Hey guys, this is Ken from Kenya. Welcome to my YouTube channel where your health is our priority. In this YouTube channel, we usually discuss the most common conditions which affect women and maybe they are not aware of what they can do or how they can get help. So today I want to discuss a very common condition called candidiasis. So what is candidiasis? Candidiasis is the fungal infection of the female genitalia. What causes this candidiasis? There are several causes which causes this form of infection. So the most common is wearing panties which contain moisture or they have not dried well up in the sun. So what happens between the legs, there is a lot of moisture because of the friction between the legs, and now on top of it the moisture content that creates a very favorable environment for the candida cells which are normally on that area to overgrow or to multiply and cause the infection. Then also taking oral drugs such as antibiotics, they kill the normal bacteria which usually protect that area. So this gives now the room for the candida cells or yeast cells to overmultiply and cause the infection. Also, chronic conditions such as diabetes, which causes or compromises the immunity of the body, can also expose a woman to recurrent candida infections. Additionally, diseases such as HIV, which also tamper with the immunity of the body, can also expose a woman to have a recurrent candida infections. So what are the signs and symptoms of yeast infection, or how does a woman recognize or acknowledge that I have a candida infection? So first, they present with a lot of itching, or what we call in medical terms pruritus. Additionally, they may also present with discharge, a vaginal discharge, which is usually or resembles yogurt. It looks like yogurt or curd-like. It is non-smelly and it just looks like a yogurt, the vanilla type. So then from there, what are you supposed to do when you experience these signs and symptoms? So when you experience these symptoms, don't worry. The first thing to do is go to a medical profession or go to the nearest facility and they will prescribe for you drugs. So this is how we manage candidiasis. One, you take per fluconazole 150 milligrams that and combine it with per metronidazole 2 grams that. If metronidazole is not available, you can use secnidazole 2 grams stat. If secnidazole is not available, you can use tinidazole 2 grams stat. Alternatively, you can use, instead of fluconazole 150 milligrams, you can use intravaginal pessaries 150 milligrams at night for 6 days. For pregnant women, they do not use, they cannot use metronidazole. They can also not use fluconazole. So instead, they are supposed to use only pessaries, intravaginal pessaries, where they are supposed to use intravaginal pessaries 200 milligram only for 3 days. So how can you prevent candidiasis? Candidiasis, one, can be prevented by ensuring that your panties are well dried up, maintaining good hygiene, and also eating a balanced diet. And if, for example, you have diabetes, ensuring your sugars are well controlled. If you are HIV positive, ensuring that you are taking your ARVs well. Importantly, and something which people ignore, taking a lot of yogurt or taking yogurt frequently is actually a very good cure because it contains probiotics which now enhance the normal bacteria which stays in that area to protect that area. Thank you guys. See you next time.